Number one thing I would never do as a neurosurgeon, and I learned this lesson the hard way, is deadlifting. I've seen way too many of these injuries where people would come into my clinic complaining of significant amount of back pain after they were deadlifting. And I'm guilty of this too, putting on a lot of weight onto that barbell and trying to get a personal record. And after seeing this type of injury over and over and over again, I realized it's something that I would never do. Now let me ask you this, and do you deadlift? Comment below, let me know if you've injured yourself.
All right, this guy claims to be a neurosurgeon. Whoop-de-doo, I don't know who he is. What we can say for sure is that he's a bit of a moron with his messaging saying that deadlifting is dangerous. Well, guess what? Throughout life, you are deadlifting. And every time you bend forward to something, you're doing a partial deadlift. So what he's really trying to say and misinterpreting or not understanding is that deadlifting with poor biomechanical proficiency is dangerous. When we deadlift with poor biomechanics, yes, there is indeed a higher risk of injuring the disc, but that doesn't mean to say that we should be telling our patients or ourselves not to deadlift, because if we don't hinge correctly and we don't move proficiently in our daily life activities, regardless of whether it's a trivial task or a physically demanding task, you will develop multifidus muscle atrophy. And we know what the multifidus muscle is for. It is the only intersegmental stabilizer of the lumbar motion segments. And if you don't have stability of your lumbar motion segments, you are going to have a bad back with certainty. So just another piece of misinformation that's put out there by someone who claims to be an expert because he's a neurosurgeon. Well, he may be, but he's also a moron. Sorry about that, but those are the facts. Talk to you next time. Thanks.